Hey, welcome to Pretty Well. Do you want to get to the root causes of your health concerns? Do you find yourself Googling, why do I feel this way? And looking for solutions to feel great again? I'm Lisa Smith, and I too felt exhausted, achy, and like I was aging too quickly. I wanted to look and feel like myself again and spent way too much time and money going to practitioners, even functional medicine practitioners, and not getting results. So I became a functional medicine practitioner myself and learned how to identify and fix root causes to health issues. The good news is there is so much you can do to reclaim your wellness. In this podcast, you'll find quick, simple, and evidence-based guidance that you can easily fit into your day so your energy will be soaring, your mind clear, and your skin will return to its beautiful glow. Let's dive in. All right. Hey, welcome back to the Pretty Well podcast. I'm Lisa Smith. Today, we have a guest who's going to blow your mind. He is an expert in an area that is not talked about enough. Today, we have Dr. David Clarke, and Dr. Clarke is the president of the Association for Treatment of Neuroplastic Symptoms, ATNS. ATNS is a 501c3 nonprofit dedicated to ending the chronic pain epidemic. Dr. Clarke holds an MD from the University of Connecticut School of Medicine and is board certified in internal medicine and gastroenterology. His organization's mission is to advance the awareness, diagnosis, and treatment of stress-related, brain-generated medical conditions. Welcome, Dr. Clarke.
Great to be with you, Lisa. Thanks for having me on.
Great to have you, Dave. I'm excited to talk about your expertise. And as I said in the intro, this is not something we talk about very much, but it's a very real root cause to complex health conditions. So how did you become involved in your expertise in neuroplastic symptoms and pain management?
Well, I was very traditionally trained. I'm as Western a physician as you'd ever want to meet for the first 7 years of my medical education and residency training. The whole idea was that if you've got pain or illness, you must have a disease or injury to explain it. And it turns out that, yes, that's true, but there's a whole other category that can cause real pain or illness in the body. And that category is symptoms generated by the brain. And it just wasn't mentioned in my first 7 years. And I was doing well through that period of time. I got an award for excellence in medical school. I got high scores on the exams, and I got into my dream residency program. So the last thing I expected in the 8th year of my training was to meet a patient I didn't know the first thing about diagnosing or treating. And this was a woman in her late 30s who had been referred to us from another university because they could not figure out why she was averaging one bowel movement per month. And we did some specialized testing on her that was also normal. And we didn't have anything left to do except her exit interview and telling her that she was going to have to live with this. But I more or less accidentally stumbled on the fact that she had been through a lot of abuse and trauma as a girl. I had no idea that that could possibly be related to a real physical illness that didn't begin until 25 years after that. But there happened to be a psychiatrist at UCLA where I was in training named Harriet Kaplan, who was certified in medicine as well, that I knew had an interest in this. And make a long story short, she cured this patient with less than 3 months of counseling sessions. And when I found out about this, in the elevator ride that changed my career, it blew my mind that you could alleviate a serious physical condition. This woman was taking 4 different laxatives at double the recommended doses every single day, and it wasn't doing anything. And Harriet cured her just by talking to her. How does that happen? But I thought, if I'm going to be a complete doctor, I should learn something about this, learn how to do this, learn a framework for it, in case I ever encounter another patient like this, which, I thought maybe 1 or 2 a year. No, it was 5 or 6 a week. When I was in private practice, there was also no Harriet Kaplan in Portland, Oregon, where I was working after I finished my training. And so I ended up trying to treat these patients myself. But the ideas, the concepts of diagnosis and treatment that I had learned from Harriet were so powerful that even as a bumbling beginner, people were getting better, people who were not being helped by the rest of the system. And this was so rewarding, as you can imagine, to be able to do this, to help people not just with, my, highly advanced technical instruments that I used for most of my patients, but just, sometimes your mind is the most powerful medical instrument. And people got better. And it took me probably 5 years, 6 years to climb that learning curve and get to be decently proficient. But after that, I was hooked, and it became 1/3 of my practice, over 7,000 patients to date.
My goodness, that is remarkable. So there's so much there. Let's talk about for our listeners, what are neuroplastic symptoms? What is stress related? What are stress related brain generated symptoms?
Yeah, the word neuroplastic is one of many synonyms for this, but my colleagues and I like it because the neuro part reflects the brain and nervous system that are heavily involved in the creation of symptoms. But the plastic part in medical jargon is actually very hopeful because it means a capacity for change. So these are people whose brains have physically changed. We know from MRI studies of the brain that the neuroanatomy is physically different in people with these symptoms, but it can also change back to a healthy pattern, as I saw in that very first patient. So these symptoms can literally be from head to toe: migraines, dizziness, ringing in the ears, temporomandibular joint problems, difficulty swallowing, visual disturbances, pseudo seizures, chronic pain pretty much everywhere and anywhere. Low back pain is a big one, but pain in the cervical spine, the neck as well. Pain in the chest, abdomen, pelvis, genitals, joints, certain kinds of rashes, many cases of long COVID and chronic fatigue, fibromyalgia, irritable bowel syndrome. There's over 100 different conditions, functional neurologic disorders, complex regional pain syndrome, anything that the medical diagnostic tests are not showing an organ disease or structural damage as a cause.
Well, that is, as I think about that, so many of the clients I've seen come and have sat across the desk from me and have said, I've had all the tests run. They say nothing's wrong with me, but I feel horrible. And so this starts to shed some light on the deeper issues, what might be going on that's contributing to this complex, chronic, ongoing health situation. So, how did you, as you started down this path, Dave, how did you begin to differentiate between people who you began to think, I think that they might be suffering from these brain generated symptoms, as opposed to something that's I would be willing to bet the brain's involved with all complex health problems, but specifically these that you really targeted and said, no, these people, this is definitely related to past trauma and deep stress and that kind of thing.
Yeah, it's a great question. And, initially, like a lot of people, I thought, if the symptoms are really severe, they're probably not brain generated. And that turns out not to be true in the least. I've had patients who've suffered from these conditions for decades, people with severe enough symptoms to put them in the hospital. My first book is called They Can't Find Anything Wrong. And the story I chose to open that book with was a patient who was hospitalized at a major prestigious university 60 times over
Oh,
15 years with no diagnosis. And when I saw her, by then I knew what to look for. I'd been doing this for a few years. And she was basically diagnosed and cured in less than an hour, just by
oh,
knowing what to look for.
right.
So the
Yes.
severity of this. Another patient, 17-year-old girl, I was asked to see her on her 70th day in the hospital. She had unexplained abdominal pain. She was getting morphine around the clock in massive doses. And she had already seen 6 other gastroenterologists who had, no explanation for why she was having this pain. You're never going to convince a patient like that the symptoms aren't real. So that was something I had to learn, was just how severe the symptoms can get when they're generated from the brain. But the steps that I follow are fairly straightforward. First, I do the diagnostic test to make sure there's not an organ disease or structural damage. And if there's none of that, then I'm looking for sources of stress in the patient's life, past and present. And a surprising number of them, the main stress that they're dealing with came from when they were kids. But the first things that I look for, just, what's happening in your life right now. One patient had been experiencing domestic violence 2 or 3 times a week over a period of 9 months, which corresponded exactly to the 9-month duration of her illness. Another patient, even simpler than that, but all the other doctors he had seen missed this. He only got his stomach pain when he was driving to work.
Mm.
When he was driving home from work, he was fine. Uh, Ditto on the weekends, when he was not at work, also had no symptoms. So, pretty obvious question that all of your viewers already know is, what was happening at work on this? And of course, he was under severe stress in his workplace, and the severe stress had been going on for a period of time, completely corresponding to the duration of his illness. So that was pretty straightforward. Another one, 25 plus years of daily low back pain. And nobody had been able to help him in all of that time. Well, it turned out that it wasn't every single day. There were 2 weeks out of the year when he felt fine. He had no back pain whatsoever. And you can already guess, I see you're smiling, what he was doing during those 2 weeks. He was on vacation, right? So I didn't want to jump to conclusions. And I wanted to make sure, well, maybe he's resting his back on a warm beach somewhere, and that's why it doesn't hurt. No, he was fly fishing in British Columbia. So he's out there in his waders in the middle of the stream. He's bending over to, pick up the fish he catches or to get bait out of the bucket or whatever. And then he tells me at the end of the day, when he's done fishing, he's helping the lodge owner clear brush from behind the lodge. Is he
Wow.
having any back pain when he's doing this? Not a bit of it. He felt great. So that was clearly not structural back pain. But the more complicated cases are the ones who had stress when they were kids. And this again took me a while to figure out. Even that, that very first patient, severe sexual abuse trauma when she was a girl for 8 years. And few patients of mine went through something as severe as that, but you can get a tremendous amount of pressure on a kid, even when you're, doing your best as a parent sometimes. But a lot of my patients went through anything from out and out abuse to much more subtle forms of pressure or being made to feel like they weren't measuring up. Pretty much anything that leads you to believe as a kid that you're just not good enough in some way can have long-term impacts that play out in a variety of stressful ways, personality traits, triggers, people, situations, or events that are creating a lot of stress for you because they kind of remind you of the past or they bring back memories of the past. Or it could be an adult who mistreated you as a kid who's still in your life today. That's a common one. And then the most difficult of all are powerful negative emotions that people have repressed, that they are not consciously aware of. And the emotions are still getting expressed, but the person is just simply not aware. So, for example, if we feel fear, if we feel anger, it manifests in our body as well as in our conscious awareness that we're angry or afraid. Some cases, shame, grief, or guilt are the main emotions that are involved. But all of these have a physical component to them. Now imagine what happens if you've got that emotion and you're not consciously aware that you have that emotion. So you still get the physical manifestation of it, but you don't know why. You might have, for example, that patient who was hospitalized at the prestigious university 60 times. She had a lot of anger at being mistreated by her mother, as it turned out, but no conscious awareness. Instead, her mother was triggering her symptoms. So when you're manifesting in the body and you don't have the awareness of the emotion, it kind of makes you concerned. What in the world is going on in my body right now? And there can be a lot of fear that there's some underlying serious illness. And then the fear leads to more symptoms, which leads to more fear. And you get into this loop that can make people, ill enough to be hospitalized in some cases.
I would guess that the repressed emotions are tougher to unearth, right? Because the patient himself or herself doesn't recognize that there's even anything there, let alone a link to physical pain or physical symptoms.
Yeah, it is the issue that took me the longest time to understand. When I was back in my beginning days in the 1980s, I would ask people about what happened to them as kids, and they'd be telling me what happened in completely matter-of-fact tone. I mean, even that very first patient who suffered pretty severe sexual abuse as a girl, she's telling me the story in the same tone of voice you'd use to read a grocery list. I mean, it was, if you didn't know better, and I didn't at the time, you would think that she had fully processed the trauma and moved on, and that it wasn't affecting her physical health anymore. But that was clearly not the case, and Harriet Kaplan zeroed in on that and helped her uncover the emotions. But yeah, it can be very difficult to unearth at first, especially if you're new in this field. A lot of my patients will tell me, oh, yeah, I went through this, that, or the other, but it wasn't that bad. Other people have been through worse. I think I'm over it now. I hear that a lot. And I can tell you a story about a patient who was an actress from the East Coast of the United States, who was telling me exactly that yes, she went through some difficulties as a kid. It turned out her parents used to verbally and emotionally battle with each other on a daily basis. And she was the only child, and she tried to play the role of peacemaker, as you might guess. And of course, since she's a kid, she doesn't succeed. So it had a terrible impact on her self-esteem. Age 8, her parents divorced, which you would think would give her some relief, but unfortunately, the parents continued to live in the same home.
Oh,
They
no.
slept in separate bedrooms, but they were still there. So from her perspective, nothing changed.
Mhm.
But she's telling me up and down, oh, it wasn't that bad. I think I dealt with it okay. Uh, my approach to helping people connect with the emotions around this is to ask them to imagine a child of their own in that same environment. And they themselves are a butterfly on the wall of that environment. And they can't do anything except watch this child try to cope. And that shifts their perspective from thinking about themselves, which is difficult because none of us has a parallel life to compare ourselves with. But if you're
Right.
thinking about an innocent child, in the case of this woman, it was her beloved 5 or 6 year old niece, whom she spent a lot of time with, absolutely adored this little girl. And I just said, okay, imagine your niece is in that home trying to be the peacemaker like you did, and you're the butterfly on the wall just watching your niece try to deal with this. What would that be like for you? And she just stared at me for several minutes, trying to process that thought experiment. And at the end, she said, after a week of watching that, I would shoot myself. And that
Wow.
was the first time she recognized just how difficult it had really been. And my purpose in that exercise is not to re-traumatize people. My purpose is to help them see that what they went through was much more difficult than they appreciate, to give themselves some credit
Mm.
for the often heroic perseverance that was needed to come through that. Because their self-esteem has typically been beaten down. I want them to flip that. I want them to think of themselves as if they had been parachuted into the Himalayas as a toddler and somehow managed to survive. And um, give themselves the self-esteem that they actually deserve. And that turns out to have very beneficial ripple effects therapeutically if they can make that change.
I can see why, because as adults, we tend to minimize what we've been through because we've come through it. We don't necessarily want to revisit it. We've got agency now, we're looking forward. Let's just leave the past in the past, not realizing the past is lodged in our body and our body remembers and our body wants to keep reminding us, until it's like that red check engine light in your car. Until you address this, I'm going to keep reminding you because it's still here. That's fascinating.
Yeah, it's a great analogy with the red light on your dashboard that's your body. And if you are totally focused on the red light, it's not going to work out well for you. If you take a piece of uh, duct tape and put it over the red light so you can't see it anymore, that's not going to be the best solution to the problem. You have to go deeper and find out why the red light is coming on. And that's what the physical symptoms are. They are your brain trying to tell you that there is something it is distressed about. I should insert here that for your viewers that are curious about whether any of this applies to them, on our website, symptomatic.me, we have a brief 12-question quiz, a self-assessment questionnaire that people can go through. And the more questions to which you answer yes, the more likely it is that this brain to body phenomenon is going on to explain your personal symptoms.
Okay, so I will have that link in the show notes, but it's symptomaticme.com.
Symptomatic.me, and it's the self-assessment quiz. Takes less than 3 minutes.
Oh, that's neat. What a great resource. So what is deep stress?
That is what I call the stresses that people don't fully recognize.
Okay.
And it can be um, the triggers that I was mentioning before. Why is a person, a situation, or an event especially stressful for you? And it turns out it's often because of those connections to the past that you're not recognizing. Certainly, those emotions that are not being recognized. People can be tremendously angry and not know it. It's like that patient who got hospitalized 60 times. It was manifesting in dizziness and vomiting in her case. And she had no idea of the level of emotions that were going on beneath the surface until we did that, imagine yourself a butterfly on the wall exercise. And then there are personality traits that can grow out of adverse childhood experiences or ACEs that can be highly stressful for people. And they just assume that this is who they are and that there's no capacity for changing any of those stressful personality traits. But if you see where they were coming from, and one of the common ones is devotion to the needs of others. People who grow up in adverse childhood experiences as kids, they try to make the situation better. They are focused on the needs of other people in the household. They tend to neglect their own needs. They don't put themselves on the list of people they take care of. So as adults, they're constantly running around fixing this problem or that problem, whether it's in their spouse, their family, their neighbors, their workplace. They are not putting themselves on the list of people they take care of. And sooner or later, your body is going to protest. So that's another form of deep stress. Lack of ability to take time for your own joy. A lot of my patients, I'll ask them, what do you do for fun? And they're like, have to think about that for a minute. So all of those things are coming from deeper roots. And when we can uncover where those roots are, it facilitates making changes. People who used to be perfectionists, for example, who could never be satisfied with whatever level of work performance they were doing, they can see that, that got its start when they were kids, that they just kept trying harder and harder and harder to solve the problems in their household. And because they were kids, they usually didn't solve them. And so they just got on this treadmill of, never being satisfied with whatever level of performance they were putting out there.
Never quite good enough. Hmm.
Or imposter syndrome is another one where, somebody gives you a good job and you're thinking, I'm not qualified for this.
Yeah.
And the answer is yes, you are. But they don't feel that way because they were never allowed to feel good about themselves as a kid.
So interesting. Let's take a step back for our listeners and let's talk about, because you and I have been talking about ACEs, like everybody knows what it is, but maybe not. So let's talk about what ACEs actually is, these adverse childhood experiences, and how people can go about checking for themselves. It's a pretty quick quiz as well.
Yeah, there is a standard 10-item questionnaire out there that was developed by a colleague of mine named Vince Felitti in the late 1990s. But there are two problems with the standard 10-item ACE questionnaire, and you can find it on the internet. And the first problem is that it's a little too long to use in a clinical environment because it's 10 questions. And
Mm.
the second problem is that it's too short because it leaves out a whole lot of forms of adversity that can have long-term impact on people.
Yeah.
So what I did in my practice, and it's one of the 12 questions on symptomatic.me, is I boiled the whole thing down to one question. And the one question is, if you learned that a child that you care about was growing up exactly as you did, would it make you feel sad or angry?
Hmm. That boils
And
it down,
if
huh?
if people say yes to that, then we need to explore and see if they've had any of the deep stresses created, if those things have had long-term impacts on them in terms of personality traits, deep emotions that they're not recognizing, negative emotions, or triggers in their present day. And usually, the longer I talk to people, the more they start to recognize the power of some of these events and situations they were in as kids. But it comes down to almost anything that makes you think less of yourself as a kid. You're not measuring up, you're not good enough. In some cases, people are made to feel worthless. Any of that can play out very long term into the adult years. Another manifestation is choosing people for close personal relationships, romantic relationships that have problems or issues or needs that you find yourself having to solve or support all the time, and the relationships become unbalanced. Many of my patients who've been through ACEs are in those relationships over and over again. They keep choosing the wrong person to be in a relationship with until they recognize that heroic perseverance that they had to come through those early ACEs in their lives and begin to think of themselves as actually pretty amazing people. And once they get there, um, they're not going to be interested in somebody who's not giving back to them, not having a balanced give and take in a relationship. And the people who used to be toxic for them are not going to be interested anymore because you're not any longer the kind of person that totally devotes yourself to solving the other person's problems. So all of a sudden, different sorts of people start showing up in your life.
That is amazing how transformative that is. And you see that over and over again. If someone grew up with childhood physical abuse, they often gravitate toward partners who perpetuate that scenario in their lives. And it's beautiful to hear that once you're able to help them get to the other side of the coin and see the truth of who they are, that they no longer, I would guess, project that. They no longer project those personality traits that would draw someone in who's the wrong person for them.
That's exactly right. Yeah, I try, very hard therapeutically with my patients to help them uh, understand that analogy I mentioned before about getting parachuted into the Himalayas as a kid, that they have to think of themselves as actually pretty amazing, that here they found themselves in this very difficult environment, through no fault of their own, and
Mm.
that they deserve tremendous credit for having made their way out of it. And if they can internalize that sense of their own worth, then they recognize they actually deserve to be with somebody who is giving to them as much as the patient is giving to the other side of the relationship. And they find themselves in much more balanced situations.
That's beautiful and completely life-changing. So what are three characteristics of deep stress from childhood experiences?
Well, I think we mentioned those.
We
The
already, okay.
long-term impact, again, number one on the personality traits.
Mhm.
Being highly self-critical is one that we haven't mentioned up to now. But if you make a mistake, you come down on yourself much harder than you would on a workplace colleague who made the same mistake. And that's often because when people were kids, if they didn't solve a problem in the household, it could have pretty significant consequences. And so they blame themselves, even though, as kids, they were not at fault for what happened, but they take upon themselves the responsibility and they feel it when they're not solving the problems. A good example is a patient of mine who, at the age of 8, she remembers trying to deal with her father's alcoholism, which led to rage outbursts on his part. And she tried to deal with this by hiding his liquor bottles. An 8-year-old should not be trying to treat her dad's alcoholism, but she did. She tried. She absolutely did her best to try to fix that problem. And of course, she failed. He would find the liquor bottles, he'd get drunk, and he'd lose his temper over and over and over again. And she just felt like, I'm a worthless piece of crap. I just can't fix this. And she was still carrying that well into her 20s when I was seeing her. Another consequence that, again, that I mentioned are those emotions. Um, a lot of my patients resemble dormant volcanoes on the outside with boiling magma on the inside. And a lot of the time, the emotions are, they stay buried. You never find them. They never come out. But in other people, they will have outbursts of these emotions that are triggered by seemingly little or nothing. They'll just get tremendously angry, for example, and then they'll wonder afterwards, why did I get so angry? That was nothing. And it's because they're carrying a lot of that emotion inside themselves. They learned how to repress it as kids because expressing those emotions when you were in a adverse childhood environment was not a good idea.
Not
So
safe. Mm-mm.
not safe. So they get very good at burying those emotions. Like that very first patient who was, sexually abused so many times, and she's telling me the story completely calm, no emotion there that was visible, but clearly was manifesting in her body instead of in the way she expressed herself. And then finally, the triggers. A colleague of mine tells a story about a patient who had severe pain in his right hand. And it had started when he got a new supervisor in his workplace. And the new supervisor, it turned out, was mistreating him in a way that was strongly reminiscent for him of the way his father had mistreated him. And so this was tremendously triggering. And he was getting an impulse that he wanted to punch out the supervisor, who happened to be a woman. So it was not going to be good for him if he gave into this impulse.
Mhm.
So it just, he didn't punch her, but the manifestation of this emotion was in his fist or in his hand with significant pain. So yeah, those are all very common long-term consequences. And if we can trace them to their roots and give people insight into how these got there in the first place, it facilitates making changes.
Yes, and that leads to my next question because you just beautifully gave us examples that help us to picture what's going on, and then we can, in our own lives, look and say, "Oh, wow, that may apply to my life as well." But do you see consistency in where certain emotions land in the body? So you see a lot of lower back pain. Does that tend to be associated with resentment, a lack of support, anger, or is it just so bio-individual you really can't map it that well?
Yeah, it is very individual. It's one of the great mysteries of this neuroplastic condition, why one individual gets migraines and somebody else gets irritable bowel syndrome and somebody else gets pelvic pain. And most of the time we don't know. Every once in a while we will find a direct connection between why a symptom is appearing, like the gentleman with the pain in his hand.
Mhm.
Another patient of mine injured her tailbone when she was 4 years old. And 50 years later, when she was having neuroplastic pain, it manifested in the same place. Very likely because the pain that she had when she was 4 strengthened a nerve connection between her brain and the tailbone that ended up getting reused for a neuroplastic purpose. Another patient that was written about by a family doctor from Scandinavia had pain on her lower right rib cage. And it turned out when the doctor took the detailed history that her father had put his hand there when he was molesting her. And he obviously put his hands lots of other places too, but that was, she clearly remembered his having put his hand on her lower right rib cage for whatever reason, and that was where the pain manifested itself. So there, occasionally we will find these connections, but the vast majority of the time, and I've treated over 7,000 people for this, we don't know why one person gets it in one place or another. I was trained as a gastroenterologist, so a lot of my patients had symptoms in that realm. But when other doctors found out what I was doing, they started sending me mystery cases with symptoms, from head to ankle. Including one gentleman, I remember he had itching over his entire body for 3 years. And when I went in to see him, I'm going, itching? I'm a gastroenterologist. I don't do itching. But he had already seen, several dermatologists and neurologists, and he was just another one of these mystery patients that they said, send him to Dr. Clarke. We don't know what's going on. And it turned out that there was a stress connection, and we uncovered it fairly readily. And 3 weeks later, his itching was 95% gone.
Oh, that's so cool. So I can imagine your practice changed dramatically from the early days until, several years in, because now, you started out as a gastroenterologist, but you're getting all kinds of people from all different health issues. Oh, so how did that look for you? Did people just come in and there wasn't a gut issue at all, but you were helping them to uncover what might be the root of what was going on?
Yeah, I mean, the learning curve for this took me about 5 or 6 years before I felt like I knew what I was doing. The hardest part was uncovering the emotions in people who were not consciously aware of it. That was a big breakthrough for me when I realized that people could have enormous amounts of anger, fear, shame, grief, guilt without being consciously aware of it. And I developed techniques for helping people connect with that. One of my patients where fear was the issue actually had a completely paralyzed stomach. Not the abdomen, but the organ of digestion. We had a specialized test, and actually I put that patient into our challenging cases course on the symptomatic.me website. But we tested the stomach to see why this person was throwing up all the time, and the stomach was basically just sitting there not contracting. And this was all coming from fear that this person had. So after 5 or 6 years, I was surprised. I worked for this big HMO at the time with hundreds of doctors, and they gave me the Doctor of the Year award, which, I was only, in my late 30s at the time. Most of the time, people who got that award were much more senior. So it was a big honor. But it also, you know, they shared with everybody why I got the honor. And it's all like, oh, okay, well, now we've got this guy who does these mystery cases. And they started sending me, the gentleman with 25 years of daily back pain and the gentleman with the itching. And There was a gynecologist who was sending me people with pelvic pain. He would have done all the tests to try to understand why his patients were having pelvic pain, except for the laparoscopy, which is, an invasive test. You make an incision, you put a lighted tube in, and you have a direct look around to see if you can find why the person is having pelvic pain. He would hold off on doing that. He would send the patients over to see me to see if I could uncover any sort of stress that might be responsible. And then he would also schedule the patient for the laparoscopy for about a week after they were scheduled to see me, just in case I didn't find anything. If I sent my report over and said, nope, person has no stress, I can't find a neuroplastic cause for their pain, then he would do the laparoscopy. Well, he had very good instincts. And I think not a single one of those women ever got a laparoscopy because every single one of them had a neuroplastic condition linked to stress. I mean, he was great. I never met him personally. All the referrals were done electronically because he worked across town. But they all of his patients, and this has been true in the scientific literature as well. There was a specialty clinic not too far from you. It was in Chapel Hill that for severe pelvic pain. And they found, I believe, over half of the women had physical or sexual abuse in their backgrounds of the women who came to that clinic.
That is incredible. What a good system he had. He had this thing down. Once he learned about you, he really did a good job with that. You helped so many people that way. What what can people be get well no, another question I have for you is it sounds like you can help people kind of rapidly because lots of people know that they've had adverse childhood experiences, trauma, abuse in the past, and they've done years of talk therapy and still haven't moved the needle on chronic pain or chronic health conditions. But you seem to help people kind of move through that process quicker.
Yeah, it varies a lot. Some people get better quickly, and I love to tell the stories about those patients because they're so dramatic. But there are definitely other people that need years of psychotherapy to achieve the same level of improvement. So there's quite a spectrum there. But it is true that the kinds of psychosocial issues that can make you physically ill are different qualitatively than the kinds of issues that usually bring people to see a psychotherapist. And when I teach psychologists and psychotherapists, I emphasize that these physical symptoms are kind of a window into a completely different realm of psychosocial struggles that people have. And if, as a mental health professional, you can learn how to understand where these symptoms are coming from, it's going to give you an insight into your client that you can't get any other way. That the body is telling us things about what's going on in the mind that the patient themselves can't put into words. So it's a sort of a parallel universe for mental health professionals. And that's what I teach, when I teach in graduate schools or teach in seminars, how to read the body almost. And when mental health professionals add this to their skill set, it makes them vastly more effective. And even people who've been through years of the traditional kind of psychotherapy, there can be this whole other universe that hasn't been investigated yet. So that's where I try to find issues in my patients that they haven't recognized yet themselves.
That's incredibly helpful for them. I can see that. What can people begin to do on their own to get started in this, how to address some of these issues in their lives?
Yeah, I wish I'd had the resources available to me in the 1980s when I started that are available today. But symptomatic.me, the 12-question quiz, each question comes with a line or two of explanation so that if you have a yes answer to that question, it will explain something about the meaning of that yes answer. And then, today we've got books, we've got videos, we've got recorded conferences, we have lots of courses out there. I have a new podcast of my own called The Story Behind the Symptoms, where I interview patients, some of whom have fully recovered from this condition and have a lot of insights to share about how they did it. Other people are not yet recovered, but still we can delve into the background and uncover a lot of things that they might not have been consciously aware of. And, that's very instructive for people. We've only just launched it in the last couple of months. We have 4 episodes that are out, and we're dropping a couple of new ones every month now. So I think,
Congratulations.
that'll help people. My first book is called They Can't Find Anything Wrong. For people that are into the science of this, we have a jargon-free textbook that we wrote for professionals, but anybody interested in science can read it. It uses the older term psychophysiologic disorders. That's the older term for neuroplastic symptoms. But I know a lot of therapists in this field are prescribing that one for their science-oriented patients. There's even an app called Curable. I've been a consultant with them, and so have a lot of my colleagues, and they put a lot of these ideas into that in a nice user interface.
Oh, those are amazing resources. I will have all of those linked in the show notes because I can just see you could dig for a long time and get so much help there. How does someone, if they realize that DIY isn't going to get it done for them, how do they either work with you or find a practitioner? What are the next steps?
Yeah, I'm a teaching only physician these days. I'm not seeing patients because I'm running the nonprofit, and teaching everybody I teach is a pretty much full-time job. But there is a practitioner directory on symptomatic.me. We've got, 100 or two people who have taken extra training in this field that can provide direct one-on-one care. And if there's nobody local to where you are, there are a number of them that practice via telehealth, and will see patients over the internet.
Okay, I'll have that link in the show notes too on symptomatic.me and where you can, the practitioner locator. But let's talk about the story behind the formation of the Association for Treatment of Neuroplastic Symptoms, your nonprofit. How did you begin that and what's the purpose of it?
Yeah, the goal is to educate healthcare professionals and the public. We are starting with just the very simple idea that your brain can cause real pain or illness in your body. And our feeling is that if people just understand that one idea, it will lead to the next domino in the chain, which is, well, why is my brain doing this?
Mm.
And the answer to that is, find the psychosocial issues in the past or the present or both that are contributing to this. And then the third domino is, hey, we got treatment for all this. People with pain or illness for years or even decades. One of my patients, 55 years of abdominal pains. Volume 3 of his paper chart was 3 inches thick. I can only imagine the amount of healthcare dollars represented just by that one chart. He was cured in less than 30 days just by uncovering these insights. So there's when the insurance companies get a hold of this, they're going to love it. And the doctors who get a hold of this, they love it. One of them took me aside at a conference and said, she'd been doing this for about a year, and she said these ideas had put the joy back into her work because
Oh,
this is 40% of people who go to the doctor. And it's tremendously frustrating for the doctors not to know what to do for these patients. They want to help, but they never got the training such as we provide.
mm.
So yeah, we got started actually at a conference in 2009, which was the first time any of us had been in a room with other doctors who did this kind of work, because we were all scattered around the country and few of us knew that anybody else had found their way to these concepts. But we spent a day finishing each other's sentences. We'd come from all different ends of the spectrum. There were, physical therapists and orthopedists and internists and pediatricians and me, a GI doctor, and we'd all converged on these very similar ideas just from working with patients. And after the conference, some of us got together and said, we need to start a nonprofit. We have to share this with the world. And, we're all volunteers. None of us get paid for this. In fact, all the money I make from speaking and from book royalties, I donate to the nonprofit. So I don't have any financial conflict of interest with this work at all.
Mhm.
And it's just grown tremendously. I mean, we have a membership program. People support us by paying annual dues, and they get a lot of discounts. They get extra places on our website with resources for them. We have a monthly Q&A on Zoom with experts where people can ask personal questions, whether they're professionals or patients. So a lot of special advantages for people who support us by becoming members.
Mhm.
And it's just, we had a conference last fall, 270 people from 8 countries came. So we're doing it again, September 28th to the 30th of 2025, Boulder, Colorado. We're expecting an even bigger crowd this time.
Oh,
So it's,
it's
it's, yeah,
gotta
it's
grow.
been wonderful to see it grow.
It has to grow because it's the missing link to so much chronic illness and pain. Well, if you could change one thing about patients and how their understanding of these chronic health situations they have, what would it be?
Yeah, not just patients, but doctors as well. Just this idea that, let me back up and I'll tell you a story about two PhD researchers who were on a national radio program talking about their long COVID or chronic fatigue. And one of them said, this can't be a mental symptom because it is so severe. I mean, they'd been almost completely disabled for 3 or 4 years. And that idea is completely wrong, that it can't be mental if it's too severe, because the brain can do incredibly severe things to the body. We have a fabulous 7-minute video on symptomatic.me that summarizes a lot of this. That video was made by a feature filmmaker who came to us to said, I want to make this film for you because she had been severely disabled by chronic fatigue. All she could do was crawl from her bed to the bathroom and back every day for over a year. And she recovered using our approach. And when if people could just understand that the brain should be considered as a possibility when you've got pain or illness in the body, both physicians and the public, that would change everything.
I think there's a stigma, a myth that we need to address before we wrap up. And that is, back in the day when we just referred to that as psychosomatic, and people misunderstood that to take it as it's all in your head. It is physical, but it's being generated from the brain. Is that right? Can we clear that up?
Yeah, absolutely. And there are a whole lot of myths that go along with that that are uh, implied in the training of medical professionals that, not only is this all in your head and the symptoms are imaginary and it means that you're neurotic, that you can't handle your own stress, that there's nothing to do for you except you're going to have to live with this. We can't diagnose you. It's not really part of a medical clinician's job description to deal with you. And not a single one of those myths is true. In fact, for most of them, the exact opposite is true. So if you gave me leeway to change a few other things in the healthcare profession, I would change all of those.
Yes, and that is where people wrongly get put on anti-anxiety medicines. And I've had people sit across from me and say, I keep complaining about these symptoms and I was told I needed to go on anti-anxiety medications. I'm not anxious. I'm in pain or I'm dealing with these symptoms. And yes, they cause me anxiety, but that's not why I'm here. And so I do think to be able to unpack that and take the stigma away so that people realize these stressors or traumas, whatever, have led to these triggers and these symptoms, they're real. But your body is now telling you it's time to pay attention. The brain is distressed, as you said, it's time to pay attention.
Yeah, there's a good analogy that I share sometimes with my patients or my audiences, and that is that my patients resemble Olympic weightlifters in terms of the amount of stress that they're carrying. But it's like they're being asked to carry 50 pounds more, than the world record for their weight class. And, anybody's body is going to break down under conditions like that. My patients are actually mentally stronger than average. They're just being asked to carry a huge burden, and they're not even able to recognize the magnitude of the burden they're carrying. So a big part of my therapeutic approach is first to show them just exactly how much they are carrying around, and then to learn how to put the burden down. And when they do that, they see how strong they have been all along.
That's beautiful and incredibly healing and life-changing. Okay, so let's talk about where people can learn more about you and about ATNS. Again, it's symptomatic.me is a starting point, right? Your book, They Can't Find Anything Wrong. Is there another book too, or is you what
Yeah,
was
the textbook Psychophysiologic Disorders that people who are interested in the science, um, I would recommend that. We wrote it without technical jargon,
okay?
even though it's intended for professionals, because we wanted the medical folks to be able to understand the psychology and the psychology folks to be able to understand the medicine. I spent a lot of time making sure that book was in plain English.
Wonderful. So it really can cross all kinds of paths there. Okay, your podcast, the story behind
Symptoms,
the symptoms. Okay. And the app, you mentioned an app Curable, which also is a fantastic resource. Is there
definitely.
anything else that you'd like to share? Any other ways to connect with you or to find out about the Association for Treatment of Neuroplastic Symptoms or anything else?
Yeah, we try to make the website be a hub for all of this. There are so many resources on there, and we're putting more on all the time. In fact, within the next week or two, we're going to launch yet another course where I'm interviewing a patient with a very complex neuroplastic illness story, and we just try to put all the pieces together of how she became ill for, severe fatigue and other symptoms for a decade and where those came from. And interspersed in the middle of the interview, we kind of break out and I make commentary on exactly what the patient is saying and what it means to, again, try to provide as much insight as I can. And I think a lot of your viewers, it'll resonate for them.
I think so. Well, what I love about it is that when any of us tell stories, a good storyteller can bring the listener into the story and they see themselves in it. And as you're telling stories about these patients, the value you bring is that people can see themselves in these stories and see, oh, there's hope for me. This is not a life sentence. I can look at this and find a new path that I didn't even know existed. So I very much appreciate you and all of your passion and commitment to helping people get well for good. And the ATNS information, is that also on symptomatic.me or is that a different?
No, it's the same. We felt like ATNS was not going to be something that people could easily remember, but so we named the website symptomatic.me as something that would be harder to forget. Let's put it that way.
Absolutely. Yes. And it'll be, as I said, it'll be linked in the show notes. So, guys, go ahead and check out all that Dr. Clarke and his team offer. It has been so insightful and wonderful having you here today. Thank you for joining.
Thank you, Lisa. I appreciate the chance to share these ideas with your viewers.
Absolutely. And I appreciate you coming on. So I know I'm going to be checking out all that you offer, and guys, go and check out what Dr. Clarke has for us. I'll be back next week. Until then, stay pretty well. Bye.